Hi, welcome back. Today we're going to talk about healthcare. I know it's something a lot of, what is it, diasporans, is that a word? People from the diaspora kind of fear Jamaica healthcare system. Oftentimes they will run back to England, Canada, America. I know of people I know who come from those countries will run back there because they think the healthcare is better. Hmm, is it? I know for England, if you don't have a permanent address, if you don't keep an address, your healthcare isn't free. After a period of time, they will take you off the list, and I think you have to be going to the doctor at least once a year to remain on the list in England. So, swings and roundabouts. It's your choice. I mean, I think need to look into the cost of the airfare, cost of you staying somewhere. Well, it's, if you already have your home overseas, have kept it, then that's okay. Or if you're staying with family, but the cost is an issue. So, but I want to talk about healthcare in Jamaica and my experiences of healthcare in Jamaica. So it's comes under two bands, like elsewhere in the world. Well, no, I shouldn't say elsewhere in the world. Um, Jamaica has free healthcare and it has paid healthcare, and I have experienced both. So in each major town, well, kind of even some districts, because up here in Discovery Bay, we have a health clinic in Queen High. And we have another one in Runaway Bay. That would be my nearest one. And then we have doctors in Discovery Bay, two in Discovery Bay, and no, three. Then one at Shretsell Clinic, which is aligned with the bauxite company. Those three, the uh, bauxite clinic and the two doctors are paid. Actually, I think it's three doctors now. Boy, look at that. Jamaica Discovery Bay is coming up. Yeah, three doctors. But you have to pay for the service and then you pay for your medication. With the clinics, you don't pay for to see the doctor. You just pay for the medication. Oftentimes with the clinics, though, the first persons you see is the nurse, and then you have to wait and see if she refers you to the doctor. So as I've said, I've done both. When I first came, I had gynecological problems, and I had to go to gynecologist in Ochi. So and he charges, but what they do, they it's on a you don't make an appointment. It's a first come first serve basis, the same as the doctors, the private doctors here. You know they do it in that order. You don't make appointments. So at the gynecologist, I was due to have an operation. So first initial payment was I had to pay to see him and get the consultation, and he was going to do the operation, and then that would be in the hospital, but I would have it done privately. It was a lot of money, so I did want to go ahead with it because I was in a lot of pain. But is it a good thing or a bad thing? COVID came. It was just before COVID. It was March 20, I think it's 2019, and then COVID came, and so the private ward at St Anne's Base Hospital was used for COVID patients. So I didn't get the operation done, and but I've come through it. So I did learn to manage the pain through herbs and meditation. So I had to find an alternative way of managing my health because the service wasn't available to me in that time. So that's another thing that you can do is to look at alternatives, and there are many herbalists. You may even find one in your community. I am grateful that I'm married to a herbalist. He knows a lot about herbs and bushes and what time to pick them, what time not to pick them, and all those kind of things. So I'm just grateful for that. Okay, so yeah, going to talk about the private entities as well. When my mother had glaucoma, she actually went to what do you call them? She went to an optometrist, I think that's the one, in Montego Bay to get her eyes done. She had her left eye first and then her right eye. And it did cost a lot of money, but it was cheaper than the fare going home back to England. So it did work out for her. Again, with my father, he had diabetes. He had his leg amputated, and he had that done in St Anne's Hospital. They did a good job. He also got his prosthesis here in Mona. So as a family, we've all benefited from the health system in Jamaica. One thing they don't have, or I haven't seen, I don't have much knowledge about, is ambulances. I know in the UK you ring 999, you get an ambulance. It doesn't happen here. Like when my mother had a stroke, we had to take her to the hospital by car. And I didn't have an ambulance number, and I was just panicking. I was in a state, so we didn't do that. But I know my sister-in-law, she had paid for a plan to have an ambulance, and they, her husband got sick, and so she was waiting on the ambulance to come. The ambulance came, but it didn't have any oxygen, and she could have taken him to the hospital in the time she was waiting for the ambulance. So all of that. So you can get private ambulances, and I know some returnees pay for them. Is it a benefit? I don't know because you have to pay every month or every year. So I've just decided I pay as you go. I pay to go to the doctor when I'm ready. If I'm not sick, I don't go. Simple. Medication now with the system. Because it's a free system, government gives you a NHF card, which is National Health Fund card. And so for some medications, you can get discounts when you get your medication. So when you go to get your medication, you have to remember to hand over your card and ask for the generic brands so you get it at a cheaper rate. So sometimes the pharmacy will want to give you the name brand. Some people prefer name brand. I'm not fussed. Whatever works. So if a generic brand is doing the same thing as the name brand, I'm not going to say anything. So that's another benefit that the government has. And oftentimes when the doctors see that you have a certain ailment, they will say to you to get the NHF card. And it's mainly for lifestyle diseases, blood pressure, we call it hypertension, diabetes, heart problems, all those kind of common lifestyle illnesses. So all in all, I would say the healthcare system is quite adequate for my needs. I've got simple needs. I don't want anything flashy. I don't have any. I was supposed to get an operation. It didn't go through. That situation was solved. So I don't have any issues about getting any medication, going to see the doctor. Always have money put down just in case I need to go to the doctor. So that's one thing I would suggest is that you have money put down to go private. The downside of using the public healthcare system is the wait. It takes you a long time because even though you go there, like say the hospital open from 8 o'clock, you probably have to wait until 10 o'clock before the doctor comes. So, and you have to get, and most people will arrive there before 7 o'clock. So there is a long line of people. That's the disadvantage of the free system is that you have to wait. So using the free system, put your patient hat on. I would say put down the money and go private because you get seen a bit quicker, even though you still have to wait, but the waiting time is shorter. Okay, until next time.